What triggers uncontrollable crying in PTSD? Uncontrollable crying in individuals with post-traumatic stress disorder can be puzzling and distressing. So, what exactly triggers these episodes? The answer lies in the complex interplay of emotions, memories, and the brain's response to trauma. When someone experiences a traumatic event, their brain can become wired to react intensely to reminders of that trauma. This heightened emotional sensitivity means that even small triggers can lead to overwhelming feelings of sadness, fear, or helplessness. One major trigger is intrusive memories and flashbacks. These are involuntary recollections of the traumatic event that can feel incredibly vivid and distressing. When these memories surface, they can overwhelm a person's ability to cope, leading to sudden crying spells as a way to release pent-up emotions. Another factor is the activation of the sympathetic nervous system. This system controls the body's fight or flight response. In PTSD, this system can be in a constant state of alert. When emotional stimuli related to the trauma arise, it can trigger physical and emotional reactions, including crying. Interestingly, tears can also contain natural painkillers, which may help the body manage stress and emotional pain. Emotional dysregulation is also a key player. Individuals with PTSD often experience abrupt mood shifts and intense feelings that can be hard to manage. This means that crying can happen suddenly and without an obvious cause, reflecting the struggle to process and regulate those intense emotions. Additionally, many people with PTSD may also experience depression or anxiety. These conditions can further complicate emotional regulation and increase the likelihood of crying episodes. Environmental triggers can also play a role. Reminders of the trauma, stressors, or feelings of loss can provoke crying. Sometimes, even minor events can elicit strong emotional responses due to the brain's heightened sensitivity. Lastly, learned emotional responses can influence how someone with PTSD expresses their feelings. Past experiences may shape how they cope with emotions, affecting when and how crying occurs. In summary, uncontrollable crying in PTSD is a result of various factors, including the brain's response to trauma, emotional dysregulation, and environmental triggers. Understanding these triggers is crucial for developing effective strategies to manage emotional responses. If you or someone you know is experiencing uncontrollable crying related to PTSD, it is important to seek professional medical and psychological support. Tailored treatments, such as trauma-focused therapy, can help address these symptoms effectively.